Chia, who's a local parent, has agreed to talk a little bit about her experience with ARKids First. We have somebody who here today who can really talk about the program with hands-on experience. It really seemed like the most appropriate way to begin the day as we reflect on what we can learn from our experiences with children as we implement health reform. Kristin, thank you so much for coming today, and please join me in welcoming Kristin Chia. Kristin.
So I don't want to get too close to this. Once again, my name is Kristin Chia. I'm a proud parent of my little boy's name is Nicholas. He is 8, and Alexis, who is 5. I work full-time, and I go to school full-time, as I have for 3.5 years. I got pregnant with my son when I was very young. I didn't finish high school. I actually had to finish working while I was pregnant with him. So my main concern was having health care coverage when I had him. I didn't know what to do. I wasn't aware of what to do as a new parent. I was 17. Someone immediately came in that day. I don't know if they worked for the hospital or for ARKids or Medicaid. She came in, helped me pick a PCP for my son, and got me covered immediately. Within the next month, I had coverage. Everything that had happened in the hospital was covered. That was a huge relief, being so young and having to work. I went back to work after about 2 weeks after having him. So to have that coverage was it was awesome. It was great. I've had every well child visit, every sick visit. I've had emergency care visits, emergency room. I've had ambulance rides. I've had tubes for both of my children. I've had any medication you can think of covered, shots. My son also sees a therapist with a life strategies counselor, and he thoroughly enjoys sharing his if he can't get things off his chest, that's how he talks to her, and he really enjoys talking to her. That's covered. She actually, even hasn't come out the past 2 summers, picked him up and taken him to a group and with other children throughout the week. I can't imagine what I would do if it wasn't for Medicaid. It's been my savior. I can't afford to pay the $200 extra on my insurance every month. I can't even have my husband on insurance. So this helps me tremendously. I just got canceled. And I just was reading in the little pamphlets that that's a main thing, about 20,000 kids get dropped. Well, I got a letter. Well, I didn't get the letter and to renew. And so I immediately applied online. I applied on a Thursday night, and by Tuesday morning I had the acceptance. That was a huge relief. I was like, it's going to take at least 2 weeks, and it didn't. It took not even a week to get my acceptance back. I changed my coverage, but I was worried about that as well, about the co-pays. Co-pays are $5 to $10. I can easily afford that. I just can't afford $200 extra a month. So the biggest thing that I had happen with my children was my son was about 18 months old. He had a fetal seizure. I thought he was going to die. He didn't look like he was breathing very well. He was turning blue. Called the ambulance. The ambulance took him to Children's. He had to stay overnight. My biggest fear after we got him to find out that he was okay was, what am I going to do with the hospital bills? I got a letter within a week saying that these were the bills, that this is not a bill, they're all covered. That was a relief, just all lifting off my shoulders. It was great. If it wasn't for ARKids, I met Susanna at my work. She came in one night and she had told me that she worked for ARKids, and I have nothing but good things to say about ARKids. I don't know if people don't appreciate it. I definitely do, because if it wasn't for them, I'd probably be in debt by $300,000 easily. For 9 years, they have covered everything. Not one thing have I had to pay for except for this past week with my son's medicine for his ADHD. That's my relief in knowing that I have coverage for my children, because I would care if I could put them for the $100 that I pay a month. I can't even afford the co-pays to go see my dentist. I have insurance, but I can't really afford the money to go see the people I need to see. But at least I have it if I need it. But my children, I don't have to worry about that with, and I would definitely take them over myself any day. All I can keep saying is that ARKids is great, and if I didn't have it, I would be lost. So it's dependable, and it's the most stable part of my life, so I'm glad that I have it, and I have to rush off to go work my double today, but